Okay, so get this. By 2050, nearly 160 million people worldwide are projected to have atrial fibrillation.
Wow.
That's double the number from just a few years ago.
Yeah.
We're diving into the 2024 European Society of Cardiology Guidelines on Atrial Fibrillation, AFib for short. You've handed us a whole stack on this one.
It is a big one.
But don't worry, that's what we're here for. To break it down so it's clear as day, whether you're a medical pro or just health curious.
Absolutely.
Right off the bat, what struck me was this AF care framework
Right.
in these guidelines.
Yeah.
It shows how treating AFib is about so much more than just popping a pill. It's like a puzzle where you have to look at the whole picture.
Yeah, I mean, the C in AF care stands for comorbidity management, meaning you have to address other health issues that might be contributing to the AFib, like high blood pressure, diabetes, or even sleep apnea.
It's like a domino effect, these interconnected health factors.
Exactly. And the rest of the framework, the carer part, is about managing stroke risk, reducing symptoms by controlling heart rate and rhythm, and making sure there's ongoing evaluation because things can change.
Right. It really highlights how important that holistic approach is. But you know me, I always want to look at the human side of things.
Yeah.
Medical guidelines can feel very clinical, but there are real people behind these diagnoses.
Well, for sure.
Yeah.
Yeah, I'm with you on that. It's easy to get lost in the technical details, but the guidelines actually address this with something called the MEHRA symptom classification, which helps doctors understand just how much AFib is affecting their patient's daily life.
So it's not just about a wonky heartbeat on a monitor.
Yeah.
It's about how that translates into someone's ability to simply live their life.
Exactly. Imagine feeling constantly tired, like you can't catch your breath just walking up the stairs. Many people with AFib experience this, and it takes a toll.
Yeah.
Yeah.
It's not just physical either. The guidelines point to increased rates of anxiety and depression in people with AFib. That hidden burden is something we really need to talk about more.
Absolutely. Addressing mental health is just as crucial as managing the physical symptoms.
Okay, so let's talk about some of the eye-opening takeaways from these guidelines.
Okay.
One that really jumped out at me was this emphasis on weight loss for overweight or obese patients.
Right, and that's not just a general health recommendation. The guidelines specifically highlight that losing weight can actually make a big difference in how much AFib someone experiences.
So it's not just about fitting into your favorite genes, it's about potentially changing the course of this condition. Do the guidelines actually talk about how much weight loss is ideal?
Well, that's the interesting part. They suggest that even a modest weight loss, like 10%, can have a positive impact. It's believed that losing weight can actually improve the way the heart functions electrically, which reduces those irregular heartbeats.
Wow, that's amazing. It seems like everything is connected.
It is.
And speaking of connections, the guidelines also highlight the link between type 2 diabetes and AFib.
Right. And here's where it gets interesting. It's not just about keeping blood sugar in check. The type of medication used for diabetes management can also play a role in AFib risk.
So it's not one size fits all.
Exactly.
Yeah.
For example, the guidelines point to metformin, that's a common diabetes medication, and SGLT2 inhibitors, which are another class of diabetes drugs, as potentially better choices for people with both AFib and diabetes.
So it's about really getting into the specifics and understanding the nuances of different treatment options.
Precisely, yeah. It's like fine-tuning a recipe. You have to adjust the ingredients and their amounts to get the best possible outcome.
I love that analogy. Now, we know the world of medicine is always evolving, always questioning, always seeking better solutions. And these guidelines actually acknowledge some of the gray areas, the ongoing debates, which I find refreshing.
Transparency is key, right? Yeah.
One area where the guidelines acknowledge this ongoing debate is with something called device-detected subclinical AFib.
Okay, break that down for me.
Basically, this refers to those silent episodes of AFib that you might not even feel, but they get picked up by heart monitors, like those implantable loop recorders or even some smartwatches.
So you might not even know something's off, but these devices are saying, hold on a second.
Exactly. And that creates this whole dilemma of when to intervene. Is it something to be concerned about, even if the person feels fine? The guidelines acknowledge this is a tough one, especially when it comes to deciding whether to start blood thinners, which come with their own set of risks and benefits.
It's like this medical mystery, trying to figure out what these subtle clues mean in the long run.
Right, and it highlights how important ongoing research is.
Yeah. Another area where the guidelines acknowledge uncertainty is in determining how much AFib is actually a problem.
What do you mean? Like, just because a device picks up a few irregular beats doesn't necessarily mean it's a five-alarm fire, right?
Exactly. There's still so much we don't know about what those little blips mean in the grand scheme of things. Do they warrant a lifetime of medication? Or are they just something to keep an eye on? These are questions researchers are still trying to answer.
It's a bit humbling, isn't it, to realize how much we still don't know? But it's also exciting to be living in a time where medical knowledge is constantly advancing.
Absolutely. And these guidelines are a perfect example of that. They're a snapshot of our current understanding constantly evolving with each new research study.
Okay, so let's talk about the management of AFib. One of the key concepts in the guidelines is this choice between rhythm control and rate control. Can you break those down for us?
Sure. Think of rhythm control as like resetting a misfiring engine. The
Uh-huh.
goal is to get the heart back into its normal rhythm using things like electrical cardioversion or medications called antiarrhythmic drugs. Rate control, on the other hand, is more about optimizing the car's performance, even if the engine isn't perfect. It focuses on managing the heart rate using medications like beta blockers or calcium channel blockers, making sure it doesn't get too high.
It's about finding the right approach for each person, right?
Exactly. And it's not always an either situation.
Yeah.
The guidelines emphasize that a combination of rate and rhythm control is often the best approach.
It makes sense. You're addressing the problem from multiple angles. Yeah, the guidelines also talk about more invasive options like catheter ablation. Can you tell us a bit about that?
Sure, catheter ablation is a procedure where doctors use heat or cold energy to create tiny scars in the heart tissue,
Mhm.
sort of like creating roadblocks to disrupt those faulty electrical signals that cause AFib.
It sounds pretty intense. When would this be considered as an option?
It's often considered when medications aren't doing the trick or if a patient can't tolerate certain medications.
So it's like the next level of treatment. The guidelines mention different types of ablations. Can you walk us through those?
Of course, one common type is called pulmonary vein isolation.
Okay.
Essentially, they're trying to isolate the pulmonary veins, which are often the culprits behind those rogue electrical signals. It's like cutting off the source of the problem.
So it's about finding where those electrical signals are going haywire and putting a stop to it.
Exactly. But keep in mind, research is constantly evolving, and scientists are still trying to figure out the absolute best ablation strategy for different people.
So even within the world of catheter ablation, there's a lot of personalization and fine-tuning involved.
Absolutely.
It's amazing how much goes into treating a heart condition that many people don't even know they have. The guidelines also briefly mention surgical options. Is that something that's typically considered as a first-line treatment?
Not usually, no. Surgical ablation for AFib is typically reserved for cases where other treatments haven't worked, or if the patient is already undergoing another heart surgery, like a mitral valve repair.
So it's about making the most of an opportunity to address multiple issues at once.
Precisely.
It sounds like a true team effort is required for the long-term management of AFib.
Absolutely. It involves cardiologists, surgeons, and other healthcare professionals all working together to determine the best course of action for each patient.
Yeah, and it's a team effort, especially um, because AFib isn't like a set it and forget it kind of a condition.
Right.
The guidelines emphasize the importance of what they call dynamic evaluation.
Dynamic evaluation. So it's
Yeah.
not just a one and done kind of diagnosis.
Right. It's about ongoing reassessment because a person's situation can change.
Okay.
New risk factors might pop up, their symptoms could evolve, or even new treatments could become available.
It's like you're constantly adjusting the sails to navigate the ever-changing seas of AFib, huh?
That's a good way to put it. Speaking of new developments, the guidelines touch on some exciting possibilities when it comes to emerging technologies.
Oh, absolutely. One area that's particularly fascinating is the potential for new screening tools like smartwatches
Yeah.
to detect AFib earlier.
Now that's something I can get behind. Early detection is crucial, especially with a condition that often flies under the radar. But are we at the point where we can rely on smartwatches for this kind of diagnosis?
That's a great question. And to be honest, the guidelines are cautiously optimistic. They acknowledge that while these devices hold incredible promise, we need more research to ensure their accuracy and figure out how they'll fit into clinical practice.
So it's a watch this space kind of situation.
Yeah.
Still, it's pretty amazing to think that something as commonplace as a smartwatch could play a role in managing such a complex heart condition.
Oh, for sure. Yeah, it speaks volumes about how technology is revolutionizing healthcare. And AFib management is no exception. But as with any new tool, It's about using it responsibly and ethically, always grounding our decisions in solid, evidence-based practice.
Absolutely. We've covered a ton of ground here,
Yeah,
from the nitty-gritty of AFib to the cutting-edge treatments and the future of care.
we have.
But I want to circle back to something we touched on earlier, the importance of patient-centered care.
Couldn't agree more. The guidelines repeatedly emphasize the need to involve patients in the decision-making process,
Right.
ensuring that treatment plans are tailored to their individual needs, preferences, and lifestyles.
It's one thing to say it, but putting it into practice in a busy healthcare system can be challenging. How do we bridge that gap and make patient-centered care more than just a buzzword?
That's the million-dollar question, isn't it? I think it boils down to open and honest communication between patients and healthcare providers.
Right.
It's about fostering a collaborative relationship where patients feel empowered to ask questions, voice concerns, and actively participate in decisions about their health.
It's about recognizing that every individual is unique, and their care plan should reflect that.
Exactly. And, the guidelines provide a valuable framework,
Right.
a roadmap, so to speak.
Yeah.
But they shouldn't overshadow the human element of medicine.
Yeah.
Each patient has a unique story, and their care should be just as individual as they are.
So it's about striking that delicate balance between evidence-based medicine and personalized care.
Precisely. And that brings us to a thought-provoking question I'd like to leave our listeners with today.
Okay.
The guidelines champion patient-centered care, but how can we as individuals advocate for a more personalized approach within sometimes rigid healthcare systems?
That's a challenge we all need to ponder, especially as AFib becomes increasingly prevalent. It's a call to action for both patients and healthcare professionals to work together to ensure that care is not only effective, but also compassionate and tailored to the individual.
I couldn't have put it better myself.
Now, we've unpacked a lot of information about AFib management today, but we've only just scratched the surface of what these guidelines cover. These guidelines are incredibly detailed, like they anticipated every question you could possibly have about AFib.
Yeah. They really do cover a lot of ground. They even dive into specific groups like people with cancer or pregnant women with AFib. And they go into detail about all sorts of medications, procedures, even new technologies on the horizon.
It's an incredible resource, that's for sure. If you're a medical professional dealing with AFib, or if you're living with it yourself, I'd encourage you to really dig into the parts of the guidelines that apply to you.
Absolutely. Think of these guidelines as a foundation for making informed decisions about AFib. But remember, they can't cover every single scenario.
So it's crucial to work closely with your healthcare provider.
Exactly. They can help you interpret the guidelines, weigh the risks and benefits of different options, and ultimately come up with a personalized plan that's right for you.
Right, and it's important to remember that these guidelines are like a living document.
That's right.
They're constantly being updated as new research emerges.
That's right. What we know about AFib today might be completely different 5 years from now.
Which is why it's so important to stay informed, stay curious, and never hesitate to ask questions.
Absolutely. Knowledge is power, especially when it comes to your health. The more you understand about AFib, the better equipped you are to manage it effectively.
Well said. And on that note, we'll wrap up this deep dive into the 2024 ESC guidelines for atrial fibrillation. We hope you found this exploration insightful and feel empowered to navigate the complexities of AFib. Whether you're a healthcare professional on the front lines or an individual seeking to better understand this increasingly common condition.
It's been a pleasure joining you on this journey.
Until next time, keep learning, keep asking questions, and keep diving deep.